Let's take a look at the new model of care known as the patient-centered medical home and how it's designed to work for both doctors and patients. Anna Owings isn't unlike many of us in that she's dealing with multiple chronic conditions.
I am diabetic. Right now fighting with some high blood pressure problems, and we're trying to get that under control. And I take my medications, which I take in the morning. Okay, levothyroxine is the first one I take. That's for my thyroid. Hydralazine for the glyceride in the morning. Amlodipine in the morning. And then I also do an insulin injection every evening.
As it is for most, good health is a priority for Anna.
I want to be around for a while, so it's important. I have grandkids and great-grandkids, and I want to see them grow. These are my children. I'm pretty proud of all of them. Jackie has her own business baking cakes, and John has his own business restoring automobiles.
But staying healthy, let alone managing multiple chronic conditions, can be tough. And at times in the past, Anna recalls feeling like she was navigating that road somewhat alone, feeling more like a number than a person.
You went in, you waited for the doctor to come in, went through your things, and out the door you went.
In between appointments, Anna had little to no contact with her primary care doctor, and if she had an after-hours health concern, her primary care office was not her first call.
Before, I don't think I really would have even thought to call the doctor's office after hours or anything. Probably go to the emergency room or something like that.
Today, all of this has changed for Anna and for many patients across the state and country.
Hi, Dr. Gray.
How are you doing, Miss Anna?
I'm doing fine.
Are you sure?
Mm-hmm.
Anna's primary care practice, Gettysburg Adult Medicine, is operating as what's known as a patient-centered medical home. In this model of care, the primary care office is just what it sounds like, a medical home for the patient. It looks like this. The patient is at the center. They're partnered with their primary care doctor. Both the patient and the doctor are then supported by a care team. The doctor and the care team work with the patient to keep them healthy.
The focus nowadays is on preventative healthcare services. So when you sit down with a patient for a well adult visit, let's say, you talk about, are your immunizations up to date? Is your colorectal cancer screening up to date? So you focus on keeping that patient well rather than catching their medical problems after they occur.
I think it's fundamental. It's one of those things where some people see going to the doctor the same as when you carry your car in if it has a problem, and they think, okay, if my brakes are squealing, I go to the mechanic, and that's the same thing for their doctor. If they're having chest pain or something, that's when they come in. But we really see ourselves more along the lines of helping you with that regular everyday maintenance.
Under the patient-centered medical home model of care, your primary care doctor coordinates your care. So if you need a specialist, they can set that up for you. Through technology, the doctor then receives information back from the specialist, so they're truly seeing the whole picture of your health.
If the primary care doc is that home, patient-centered medical home, the specialists are the neighborhood. So we all come together to support the patients.